What is psychoanalysis? As is well known, psychoanalysis, defined as a set of psychological theories and therapeutic techniques with a core belief that all people possess unconscious thoughts, feelings, desires, and memories, has its origin in the work of the Austrian neurologist and social philosopher Sigmund Freud. In fact, Freud was considered to be the founding father of psychoanalysis. In a lucid and non-specialist description of the discipline, Freud describes psychoanalysis as comprising 1. A discipline founded on a procedure for the investigation of mental processes that are otherwise inaccessible because they are unconscious, 2. A therapeutic method for the treatment of neurotic disorders, and 3. A body of psychological data evolving into a new scientific discipline. Freud's third and broadest category comprises his work on culture, which based largely on the view that culture is a product of the diversion, or sublimation of sexual energy, and art, which provides the starting point for the many varieties of psychoanalytic criticism. Freud's two series of introductory lectures on psychoanalysis provide an excellent overview of Freudian theory. Later, John Laplanche and John Bertrand Pontalis' The Language of Psychoanalysis provides an essential guide to the concepts and terminology in psychoanalysis. Although the history of psychoanalysis is inseparable from that of Freud's life and of the long self-analysis which led him to write his great interpretation of dreams, it is clear that his new science is rooted in the traditions of 19th-century psychology and biology. Freud's ventures into anthropology, which he views as an integral part of his new scientific discipline, are also influenced by 19th-century theories of evolution and by their attendant Eurocentrism. Hence, the analogy between the mental life of savages and neurotics posited in Totem and Taboo, and the argument that the life of the individual reenacts, or repeats the life of the species. It is also clear that Freud's descriptions of the workings of the unconscious, with its flows of energy, and of libido and its mechanism of discharge, owe much to the physics and hydraulics of his age. Freud constantly revises and reworks his theories, and all the modifications he introduces are closely related to developments at the clinical level as he gradually abandons the therapeutic technique of hypnosis and catharsis in favor of the talking cure, and moves from his early seduction theory of hysteria to a theory of both neurosis and normal development that is based upon the discovery of the Oedipus complex and its vital importance in psychosexual development. Yet, despite all the changes that are introduced, there is a constant emphasis on the unconscious and on sexuality, defined in such broad terms as to include the oral and anal dimensions and not merely the narrowly genital or procreative dimension. It is important to note that it is the emphasis on sexuality that leads to the major disagreements between Freud and Jung, whom the former at one point regarded as his crown prince. Freud's theories are obviously not beyond criticism, but they have had an incalculable impact on the 20th century vision of sexuality, not least by insisting that children are not asexual, and have a sexual life of their own. The best account of the gradual development of the technique of psychoanalysis is that provided by Freud himself in his correspondence with Wilhelm Fliess, the ear, nose, and throat specialist with whom he collaborated in the 1890s, in the studies on hysteria co-authored with Joseph Breuer, and in the 5 published case histories. The technique that evolved is still in use today, sometimes with certain modifications. The central element of this technique is the method of free association, with the patient, or analysand lying on a couch and with the analyst sitting slightly to the rear and out of eyeshot. The patient is required to tell everything and omit nothing, and the analyst to listen to everything, and to privilege nothing. Free association around dreams or memories allows unconscious chains of fantasies and wishes to be reconstructed and then interpreted so as to uncover underlying structures which, typically, relate to the Oedipus complex, family romances, and repressed childhood memories, usually with a sexual content. Although dreams are described by Freud as the royal road to the unconscious, it should be noted that the psychoanalyst's raw material is not the unconscious itself, which is by definition inaccessible, but material that has already been shaped by the dream work. The central factor in the analytic treatment is the transference that allows unconscious or repressed material to be reactualized in verbal form rather than reproduced in symptoms, and projected onto the analyst. In a classic Freudian psychoanalysis, the analysand has daily sessions of analysis, each lasting 50 minutes, the so-called analytic hour. It must be noted, however, that Freud never claimed that his method was a universal panacea, but once remarked with typically pessimistic wit that it could transform hysterical misery into common unhappiness. Although psychoanalysis is widely practiced and has had an important influence on related therapeutic methods, it has never been defined in either medical or legal terms. The profession is self-regulated and its standards of practice are defined by the various national associations recognized as competent by the International Psychoanalytic Association. The would-be psychoanalyst undertakes a personal analysis before embarking upon a rigorous training analysis designed to promote a recognition of the importance of transference and countertransference. Qualified analysts normally work under the supervision of their seniors, and usually undertake at least one second analysis. The first generation of psychoanalysts were, like Freud himself, doctors of medicine, but suitably qualified non-medical or lay analysts were admitted to the profession from the 1920s onwards. The desirability or otherwise of medical qualifications is a matter for the various national associations. The question of the scientific nature of psychoanalysis remains controversial. The British Medical Association, for instance, has always argued that it is not competent to judge either its therapeutic or scientific value and, therefore, maintains a neutral stance on the matter. One of the more common philosophical criticisms of Freud and his followers is that they seek confirmation for their theories and do not test them by invoking the epistemological criterion of falsifiability. Lastly, it is interesting to note that Freud's own career was punctuated by a series of breaks with colleagues to whom he had once been close, and the history of the psychoanalytic movement is one of splits and schisms, as well as of international expansion. All the major tendencies within contemporary psychoanalysis claim a Freudian ancestry, but take as their starting point different periods in his work or different aspects of his theories. Very systematically, the main post-Freudian currents within psychoanalysis are ego psychology, Kleinian analysis, object relations theory, and Lacanian analysis.